Hello, folks, and welcome to this week's lesson. Today we're talking about Chapter 13, hallucinogenic drugs, or otherwise substances that have been known to alter somebody's or change somebody's perception of reality, or the way they see things, hear things, believe things. Ever since the beginning of time, humans have sought ways to alter their consciousness, and usually through trial and error. Certain plants were identified as having mind-altering properties. In early times, over 6,000 plants were capable of altering consciousness. And again, this was mostly by personal experimentation. Most of the times, these substances would be used for religious, spiritual purposes, or a way of trying to attain enlightenment or communication with what was perceived as a higher order, and sometimes just used for escape from daily living. It wasn't only till the mid 20th century, about after World War II, where these substances were examined in the lab and researched and found to have not only some escape qualities, but also some therapeutic qualities to them as well, and some legit and some non-legit. So there is some terminology that goes hand in hand when describing and discussing certain types of hallucinogenic drugs. Remember, a hallucinogen refers to a drug that causes profound distortions in a person's perception and reality. Back in the 1900s, a German pharmacologist named Louis Lewin coined the term fantasticants, uh, describing drugs that have stimulating and inebriating properties, and also described their importance in research and science. Uh, During the counterculture era of the 1960s, in the area of tie-dyed shirts, Woodstock, acid rock, and political activism, the term psychedelic became very popular. Although in medicine, there really is no recognized term as psychedelics. Because media tended to sensationalize the over psychotic-like symptoms and syndromes produced by many types of hallucinogenic drugs, the science community kind of jumped on board and coined the term psychotomimetic. The term mimetic is a term that refers to something that mimics the effects of another substance. As we said earlier in the chapter, when we talked about sympathomimetics, these are drugs that mimic the activity of the sympathetic nervous system. And then finally, we have the term psychotogenic, which is more of an accepted clinical term referring to psychosis generating substances. Now remember, the term psychosis is sometimes associated with bits of violence and outbursts, but really all it does is refer to an altered perception of reality, where things are not perceived by the five senses as they normally are under normal circumstances. And there's a whole list of various types of hallucinogens, classic and dissociative. We'll talk about most of them in a few moments. And again, remember that almost the majority of hallucinogenic substances have really over the years come from very natural sources, from plants, fungi, herbs. Only recently were some of these substances actually created synthetically in the lab, the two main ones being LSD and MDMA. But one of the earliest, most common hallucinogens was the mushroom Amanita muscaria, also called fly agargic. It's been used in Europe as an insecticide for many years. It was used in ancient Hindu rituals, went under the term called soma. It's one of the most earliest and common known hallucinogens. It passes through the body unchanged. It's not metabolized in the liver, and it's excreted in the urine. It has various physical effects. It lowers heart rate, elevates blood pressure, causes constriction of the pupils, excessive perspiration and salivation. There is some belief that Viking warriors back in the day used to ingest these products to come off as more fierce and battle ready. Um, Although I wouldn't really suggest giving that to modern day armies. St. Anthony's fire is a hallucinogenic plant that was used in ancient Greece for religious rituals thousands of years ago and is found in the fungus claviceps. It's typically grown on cereal grains. Um, it delivers a property called ergotism, which is poisoning produced by eating a grain effect by ergot, which is highly toxic. There's some belief that this fungus was responsible for an epidemic of thousands of deaths in Europe in the Middle Ages. This was implicated in some of the abnormal behaviors of citizens that implicated them in the Salem witch trials back in the pre-colonial times in the 1600s. Its effects include hallucinations, convulsions, epileptic symptoms, and delirium. Brief episodes of odd, bizarre behavior. It was actually from this fungus that LSD was derived back in the late 1930s. And speaking of our go-to hallucinogenic drug, LSD, was discovered by a scientist named Albert Hofmann in 1938, working in the lab, when he had accidentally introduced a small portion of this substance into his system. Some believe either by getting a drop in his eye and having it absorbed through his eye membranes or through his nasal membranes, and self-described some various interesting symptoms, seeing visual cues and hearing pleasant tones, which led him to do further research on this, and ultimately discovered that could have been a lot of therapeutic use for this substance. Hallucinogenics over time have been studied therapeutically, especially in the field of psychotherapy, for breaking down very structured mental bonds to help rearrange thought processes, especially in areas of anxiety, depression, and chemical addiction. It is the most powerful hallucinogen known today. Tolerance develops pretty rapidly. People will not feel the effects if they've taken it for 3 or 4 days in a row. However, there's no withdrawal symptoms known, different than things like alcohol and cocaine and heroin. Its behavioral effects on the average last about 6 to 8 hours, although sometimes longer, up to 12. And it pretty much operates on the neurotransmitter serotonin. It has very little affinity for dopamine, making it a non-addicting drug, contrary to what the federal government has it listed as. Schedule 1 drug, as we know, is a high potential for addiction, no valid medical uses, although the research tends to point otherwise. It tends to bring about a syndrome of what's called synesthesia, or blending of the senses. So the drug somewhat makes the brain reach out and make different connections to areas of the brain. So in effect, the occipital cortex, which is responsible for interpreting visual cues, may reach out and stimulate the auditory cortex in the temporal lobe of the brain, so that people will actually hear colors, or just the opposite, they'll see sounds. I know it's very difficult to conceive, but this is all just basically the way the brain is wired. There is a syndrome called hallucinogen-induced persistent perception disorder. As we said, most what we call trips usually last about 6 to 8 hours, or most experiences, although flashbacks can occur from time to time without warning, or without any precognition. A person may re-experience the effects of one LSD trip days, weeks, months, or even years after using it. Although LSD has never been proven, contrary to what the literature says, to induce psychosis or induce or cause schizophrenia, in people with an existing risk of mental disorder, LSD may wind up exacerbating the symptoms or stimulating real psychosis. But again, always remember there's a difference between correlation and cause. There has been no link between LSD use and mental health problems later on in life. Older research, as I said before, looked into giving patients LSD to help them develop personal insight, to help them explore their moods, their own sense of self. And presently, LSD is today still a Schedule 1 drug with no accepted medical use. And probably the big reason for that was, again, the war on drugs propaganda in the late 60s and 1970s. From the 40s to the 50s to the early 60s, many universities were experimenting with LSD and looking for clinical applications. And a lot of this research was legit and popular until some of it spilled out into the general public. And that's when the federal government got involved and became very concerned that this counterculture, acid trip culture that was facilitated by LSD would prevent people from fighting in the Vietnam War. So, in which case, the President Nixon deemed LSD as one of the public health enemy number one. Many famous artists over the years, including many popular musicians such as the Beatles, Jimi Hendrix, Eric Clapton, just to name a few, have touted LSD as facilitating creativity, enhancing their ability to perform. That's difficult subject to measure. We do know that LSD changes the parahippocampal activity in the brain. Uh, it gives enhanced meaningful thoughts, emotions, and imagery. LSD is usually consumed orally. Diluted drops are placed on a blotter paper, which is placed on the tongue, or sometimes they're placed on very decorative stamps, and when licked, they're introduced into the body. And of course, there's also a very dark side to the history of LSD as well. When it came into the US in the 1950s, um, the government took hold of it and experimented with it. And it's reported that the CIA conducted experiments to assess whether it could control the mind and serve as truth serum. There's also reports that the former Soviet Union and Russia did the exact same thing. There have been documented reports of soldiers in the army being given LSD without their knowledge or consent to see how it would affect them in day-to-day operations in combat, and multiple lawsuits have been won for that incident. As we mentioned before, as research increased in the 50s and 60s, LSD somewhat leaked out of the lab and became integrated into American society and culture. And there was much non-medical use which increased, especially during the time of social upheaval and conflict in the late 60s with the Vietnam War situation, the Civil Rights Movement. Dr. Timothy Leary was a professor at Harvard University who believed LSD and another hallucinogenic drug called psilocybin could be used psychologically and induce spiritual healing. And he did a lot of research, which was funded by the university. And his research involved using a lot of college students, and so did a lot of controversy with this research. As the popularity of this drug grew, so did its negative publicity. And Dr. Leary was subsequently fired from the university and then kind of took off on his own, starting his own spiritual movement, promoting and propagating the use of LSD. In 1975, the federal government cracked down and banned it illegally. Uh, Dr. Timothy Leary became somewhat of a well-known, uh, I don't want to say cult leader, I think that would be inappropriate, but definitely an ideological leader, and whom Nixon even referred to as probably the most dangerous man in the country. I don't know if that's an accurate portrayal or not. Peyote is a hallucinogen that the Aztec Indians and Native American Indians have been used for hundreds of years for religious rituals. When Spanish conquerors came down to South and Central America, they pretty much condemned it for its satanic trickery and abolished its use. But it comes from the Lophophora willemse cactus, which I have a hard time pronouncing. And its active ingredient is something you might have heard of called mescaline, which is its psychoactive agent. And it produces effects that are similar to those of norepinephrine in the brain, and its effects are somewhat less intense than LSD. It does produce euphoria, and in large doses it can generate hallucinations involving intense colors, tastes, and feelings. There has been some interest in it, in that it may be beneficial in treating addiction, depression, anxiety, and cluster headaches. And if you don't ever heard the term cluster headaches, these are severe headaches that sometimes lead people to suicide, that they're so intense. There has been shown to be a cross tolerance between mescaline and LSD. So if one is taking one, they may not show an effect towards the other. There's also been a resurged interest and a comeback in the drug psilocybin, which is found in many different species of mushrooms. So AKA, usually get the term magic mushrooms from this compound. It's found in many different species. They all contain the same active ingredient, which is chemically similar to LSD. However, the effects are shorter and not as intense. And there has been renewed interest in the use of this compound in the fields of psychiatry, psychotherapy, and addiction management. In small doses, it brings about feelings of euphoria and relaxation. Higher doses, it distorts perception of time and space. The user is usually more distracted and is more easily open to suggestion and letting the truth come out when they're speaking about their experiences in therapy. It also interferes with the ability to concentrate. It has somewhat unpleasant side effects. It has a very unpleasant taste. It dilates the pupils, raises the body temperature, raises the pulse rate and blood pressure. It can also lead to involuntary contractions of the arms and legs, followed by muscle relaxation. This drug is capable of producing an array of emotional responses, from uncontrollable laughter to depression. The person usually feels the effects within about 30 minutes, and it can last about 3 to 8 hours. It really depends on the environment that they're taking the substance in. If it's a controlled, calm, comfortable environment like a therapist's office, usually the experiences are quite pleasant and calming. If it's in a negative environment, such as an impoverished building or a back lot or something, the experiences, or the trips, so to speak, can be a little more unpleasant or even negative. Anticholinergic substances have a long history and are natural products mostly belonging to the potato and tomato families. Although they may be very highly toxic in large doses, a lot of these substances are used today in mainstream medicine. Some examples of anticholinergic medications include atropine, which is used for abnormal heart rhythms. It's used to dilate the pupils. It's even used to treat chemical toxicity from warfare. If you ever saw the movie The Rock, you might get to see an example of what that's used for. Atrovent, which is an anticholinergic as well, which helps open up the bronchial passages. Scopolamine, which is used for seasickness and dizziness. Although these products in excess can be very toxic. Back in the 1990s, we had incidents where people were mixing heroin with scopolamine. And when we responded to the heroin overdose and knocked it out with Narcan, the scopolamine would kick in and cause bizarre, outrageous, highly psychotic, highly violent behavior. But that being said, there have been natural products for the hallucinogenic effects of these products over many years. Probably one of the most well-known of which is something called belladonna, which is translated into beautiful lady. It's toxic even in small doses. In small doses, however, it has been used medically to treat irritable bowel syndrome and excessive diarrhea, although it's not marketed anymore, at least legally. There's Datura, which is also known as local weed or Jamestown weed. It can cause extreme delirium. The symptoms appear about 30 to 60 minutes after ingestion and may last up to 24 to 48 hours. Mandrake is a root up in the left-hand side of the slide, which resembles a human body, belongs to the nightshade family. It contains a combination of scopolamine and atropine, and which we said induces euphoria, sedation, and disorientation. Nutmeg and mace, you think nutmeg, wow, that's just a spice, but nutmeg can induce visual and auditory hallucinations if consumed in large quantities. It has a product called Mirasystem, which is found in both agents, and its side effects include nausea, severe headaches, vomiting, tachycardia, and early sensory distortion. There are some other products, something's called dissociative hallucinogens, which distort sound and sight, but also may produce feelings of detachment away from reality. Salvinorin A, otherwise known as salvia from the sage family, produces a dissociative state similar to ketamine. There's DMT, derived from the leaves, bark, and seed of various plants. Again, another Schedule 1 drug used for spiritual purposes. Usually lasts for about 1 to 2 hours. Speaking of your dissociative hallucinogens, probably one of the most popular ones is something called phencyclidine hydrochloride, or what's commonly referred to as PCP, or angel dust. It was first developed as a surgical anesthetic, and it's still used in veterinary medicine. It causes a dissociative reaction, which causes a person to feel separated from reality, but still in tune with reality. And I can tell you from personal, not from personal exposure, but from personal events, responding in the 911 system, it can bring about severe violent behavior. Do you remember the term we called excited delirium, where patients can try to break through their own handcuffs that police have put on and cut themselves down to the bone? It can also bring about coma, seizures, and death. When these patients are confronted in the 911 situation, they have to be restrained and sedated chemically with benzodiazepines so they can be properly evaluated and taken into the ER. And then another very interesting thing, hallucinogen, which we might have spoken about prior, is ketamine. Ketamine is most commonly used in veterinary medicine. It's a Schedule 3 drug capable of producing confusion, hallucinations, delirium, excitement, irrational behavior, and respiratory depression. However, there has been a lot of new research in the effects of ketamine for procedural sedation, and also for treatment of things such as intractable depression, anxiety disorder, and substance abuse. And the literature at the time of this production seems to be very encouraging that this may be a well-regulated and very safe treatment for these type of mental health conditions. There's a lot of promising research going on with this product. So in any event, that is the end of this discussion today. So to recap, things that you should take away from your readings, your homework, and from our discussion is to distinguish between classic and dissociative hallucinogens and provide examples of each. Describe a little bit about humans' history with hallucinogens, the spiritual aspect, the scientific aspect, the cultural aspect. List the physiological and psychological effects of LSD. Recognize the potential for long-term effects of hallucinogens, including flashbacks, hallucinogen-induced persistent perception disorder. Describe the events that led to the popularization of LSD, the relationship between LSD and mental health. Explain our experiments with LSD conducted by the U.S. government. Appreciate the role hallucinogens have played in native societies. List the side effects associated with mescaline and psilocybin, the legal status of anticholinergic hallucinogens and the impact on their use. Analyze the potential medical benefits of hallucinogens, and describe the physiological and psychological effects of ketamine, otherwise known as Special K and PCP. And with that, have a great week, and we'll pick it up next time.